My name is Dr. Lulu Francis. I'm a senior consultant general surgeon, head of Department of Surgery, Arua Regional Referral Hospital, and the focal person for this camp. This camp is named as the Mini Pediatric Surgical Camp, which is a camp organized primarily to operate on children who were operated in January this year. We had a bigger surgical camp this year where close to 200 children were operated, and some of the children require second stage or another operation to complete the procedure. So this camp is aimed to complete the surgical procedures which were not completed during the first camp in January. The target is to see close to around 50 children, out of which it was estimated close to 40 children will be operated during the camp period, which runs from 6th up to 10th of July this year.
On behalf of Amigos Internacionales, I wish to extend our heartfelt gratitude to our dedicated surgeons, anesthesiologists, the medical officers, the nurses, the students and the support staff, and all the other volunteers who have taken their time and skill and commitment and generously come to offer the compassion to the people of West Nile region, particularly the children. Also, I would like to send my sincere gratitude to the partners, to the donors who have made this possible. Your investment is saving lives in the region. Your investment is supporting the Uganda healthcare system through skill transfer, and also ensuring that children live a healthier and fulfilling lives because they are accessing the much needed quality surgical service.
My name is Rizzo Patience. My baby's name is Dizamungun Amazing Melvis. He has problem with the private part, was facing behind. We told that it cannot work. We went at Kuluva Hospital. They told us to come here. Now at first we want to thank Almighty God for organizing this new day. We want to thank Amigos International for helping us. We thought that our problem cannot be solved, but we are so glad. We have seen change. We know that it will be okay.
I want to thank for Amigos for bringing this service in Arua. Today I'm glad. I know my child is going to be healed.
I would like to send my sincere appreciation to the medical team from Amigos International, Doctors Mission International, and BethanyKids for making this surgery possible for my boy. From the research I've been making, I've been hearing it needs a lot of money, but through this surgical camp, it has been done free of charge. I cannot take this opportunity for granted. I really want to appreciate the team. May God reward you abundantly.
Fortunately, Amigos Internacionales, in partnership with local organizations, Doctors on Mission, BethanyKids, and the local hospital here, we have been in position to unite forces to provide these surgical care services to children that need them most. Arua was able to receive the first pediatric surgical camp back in January 2026, earlier this month, about 6-7 months ago. And some of the children we operated on actually received life-saving surgeries, but some of them needed second surgical procedures to be performed on them following the first procedures that had been performed earlier in January. So with all this, we had to arrange something else for them. Together with our friends and our partners, again, we came together to organize a mini pediatric surgical camp, a follow-up from our most recent camp that we held here at Arua Regional Referral in January. Among some of the services that we are offering are pediatric surgical consultations with some of our volunteers that have come through to make this possible. In addition to the consultations, we are able to give training to the local staff, but also empower communities with these procedures for them to be in position to not move around with the children, but the children to receive life-saving surgeries in this community right here.
As I speak now, since the arrival of our team from visiting team from Mbarara, we have seen close to 45 children. Out of the 45 children, 30 of them have been operated up to today. On top of the children who have been operated, I'm glad to inform you that our surgical team were also able to support Arua Hospital and operate on some of the emergency cases which came along the way. From Monday to Thursday today, our surgeons were able to also operate on 3 emergency surgical cases, and all of them are doing very well. Even our children who have been operated are recovering very well from their surgeries. We have not yet had any serious or adverse outcome where complications arise and threaten life. They are all recovering very well, and we hope within a week most of them will have been discharged.
God has given us the ability right here in this place in Arua Regional Referral to be concluding a 1-week pediatric surgical camp, a mini camp, a follow-up camp from the most recent one we had here in January.
Hello, my name is Dr. Dennis Oluka. I am a pediatric surgery fellow with BethanyKids Uganda from Mbarara. We thank God so much for this week that has come to an end. It has been a week of transforming lives here in West Nile, where the need in the region for pediatric surgery is so immense. And I thank the partners for coming together to bridge this gap. And today we don't only celebrate an end to an activity, but we more so celebrate health that has been restored. We celebrate hope that has been renewed. We celebrate a future that has been rebuilt for these children and their families. I also want to thank the administration of this hospital, the Ministry of Health, for accepting to partner and work with us.
Good evening, ladies and gentlemen. My name is Dr. Rebecca Nabawera. I'm a finalist resident of Anesthesia and Critical Care from Mbarara University of Science and Technology. I would like to congratulate my team upon a successfully completed pediatric camp at Arua Regional Referral Hospital, conducted by Mbarara University in conjunction with Amigos Internationales and Doctors on Mission to help children of this region attain surgery. One of the most interesting cases was that 1 day old, actually hours old, a child who was delivered from one of the health center falls from around, and they were referred here. They had a condition that would have actually needed them to travel up to Mulago to be operated, but luckily enough they have also been able to be saved here because we could provide the safe anesthesia that they needed, and we could also provide the safe surgery that they needed. Thank you, Amigos. Thank you, Doctors on Mission. Thank you, Mbarara University, and thank you, Arua Regional Referral Hospital, for allowing this time to happen and saving many children of Uganda.
Together with friends and partners, and on behalf of all the volunteers, I want to say thank you to everyone who has made it possible for us to be in position to operate all the children that we have operated here in Arua, but also to all our volunteers. We want to say thank you for offering yourself to be here amidst of all that is happening, the Ebola outbreak that is happening. The fact that you're able to brave yourself to come and offer these services is a privilege, and it's a big opportunity for us to draw from. Thank you so much for always partnering with us and for always supporting us in all these endeavors that we have. May God richly bless you. And on behalf of the whole team at Amigos Internacionales, the board of directors, the Ugandan team, I want to say thank you to all our partners and all our donors and all the organizations that have come together to make it possible. May God richly bless you.
I would love to thank Amigos International.
Amigos International.
Amigos International.
Amigos International.
Amigo International. May God bless you.